Most people over 65 are told the same thing about walking. Just keep moving and try to hit your step count. It sounds sensible, it sounds safe. But here is what nobody tells you. Chasing a big daily step number with no attention to how or when you walk does not protect the two organs you are most afraid of losing. Your heart and your brain do not count steps. They respond to something else entirely, and almost no one explains what that something is. Here is a clinical observation that geriatric and cardiology clinics see every single day. The seniors who stay sharp and stay independent are very often not the ones logging the most miles. They are the ones who take a short, deliberate walk at the same time each day. Large population studies over the last decade have consistently pointed the same direction. Even 10 to 15 minutes of daily walking is linked to meaningfully lower rates of heart trouble and cognitive decline in older adults. Not 2 hours, 10 minutes, done right, done daily. So here is what this video gives you. 5 specific things a single 10-minute walk does inside your body after 65, counted down one by one. And the one insight that a rushed appointment almost never has time to explain. The number one item on this list is something almost nobody talks about. Stay with me until the end, because that one can change how you approach the next 10 years of your life. Let me tell you why your doctor has probably never walked you through this. A standard appointment for someone your age runs about 12 minutes. In that window, your doctor has to review your medications, check your blood pressure, look at recent labs, and address whatever brought you in that day. There is simply no time left to teach you how a 10-minute walk changes your arteries, your blood sugar, and your memory. So you get the short version. Keep moving. Stay active. It is not bad advice. It is just advice with all of the mechanism, all of the how and the why stripped out. And I want to be honest with you about what this channel is. I am not here to sell you a supplement or scare you into a course. I have nothing on a shelf for you to buy and no fear to sell you. This channel exists to give you the science a 12-minute appointment never has time to cover. No hype, no pressure, just the reasons behind the recommendation so you can actually use it for yourself. Because the stakes here are not really about numbers on a chart. They are about whether you can rise from a chair without your heart pounding, whether you can walk to the mailbox and back without stopping, whether you can hold a conversation and remember the name of the person you are talking to. This is about staying the person who does things for themselves. So tell me in the comments where you are starting from, your age, and how many minutes you walk on a normal day. I read those, and they shape what I make next. Now let me give you the one mechanism that ties all 5 of these together. When you walk, your leg muscles squeeze the veins deep inside them with every single step. Those muscles act like a second pump, pushing blood back up toward your heart and your head. Think of your circulation like a river system, with your heart as the main pump at the center. Down in your legs, far from that pump, the current slows and blood tends to pool, especially when you sit for hours. Every step you take works a network of smaller pumps that keep the river flowing all the way to the edges and back. When those pumps sit idle, the delivery of oxygen and fuel to your heart muscle and your brain cells quietly falls behind. Please do not skip this section. It is the key to everything that follows. Every one of the 5 things we are about to count down is really this second pump doing its job. If this is already making sense to you, tap the like button so more seniors can find it. It is the one small thing I will ask of you in this whole video. Let us start the countdown at number 5. And number 5 is this. A 10-minute walk lowers the blood pressure sitting on your artery walls. Here is what is actually happening inside you. When your leg muscles start working, they need more blood, so the tiny vessels feeding them open wider to let it through. That widening lowers the resistance your heart has to push against. Picture your arteries like garden hoses that stiffen and narrow with age. A gentle walk is like slowly opening the nozzle, so the same water flows with far less pressure behind it. Your heart feels that relief immediately, and with a daily habit, it starts to feel it at rest too. Large clinical trials have consistently shown that regular light walking lowers resting blood pressure in older adults, often by a margin that matters. The effect is real, and it builds over weeks. So here's your protocol for this one. Walk for 10 minutes at a pace where you can still talk, but not sing. That talking pace is your target dose, not a stroll and not a race. Do it once a day, every day, ideally at the same time so it becomes automatic. If 10 minutes feels like too much at first, start with 5 minutes in the morning and 5 in the evening. The most common mistake people make is starting too fast on day 1, feeling sore or winded, and quitting by day 3. Slow is the point. Consistency beats intensity every time here. Now for the safe setup, because this must be safe before it is anything else. Walk a flat, familiar route, indoors along a hallway or outdoors on level ground. Keep one hand free to reach a wall, a rail, or a counter if you feel unsteady. If you feel chest pressure, sudden dizziness, or pain that is sharp rather than tired muscles, stop and sit down. Sharp pain means stop, not push through. And if you take blood pressure medication, talk to your doctor before changing anything, because as your pressure improves, your doses may need review. Pair this walk with one simple thing at breakfast. Drink a full glass of water before you head out, because morning blood is thicker after a night of no fluids, and hydration helps everything flow. Water plus movement is a better morning tonic than a second cup of coffee, but lowering the pressure in the pipes only solves part of the problem, because you can have calm pressure and still have blood that runs thick and sluggish, quietly straining your heart. That is exactly what number 4 fixes, and it happens in a place most people never think about. Number 4, a 10-minute walk after a meal blunts the blood sugar spike that damages your vessels and your brain. Here is the mechanism, and it is beautiful in its simplicity. When you eat, sugar floods into your bloodstream. Your working leg muscles can pull that sugar in and burn it for fuel without needing much insulin at all. Think of your muscles like a sponge. A resting sponge sits there while sugar pools around it, but a moving sponge soaks it up. A walk right after eating turns your legs into that thirsty sponge, right when the sugar is arriving. Research from major universities has repeatedly shown that a short walk after meals lowers the after-eating blood sugar surge more effectively than the same walk taken at another time of day. Timing is the whole secret here. So here is the protocol, and the timing is everything. Within 30 minutes of finishing your largest meal, get up and walk for 10 minutes. Not 2 hours later. Within that half-hour window, while the sugar is still rising. Even a slow, easy pace works, because it is the muscle contraction that matters, not the speed. Do this after your biggest meal of the day at minimum, and after every meal if you can manage it. The error people make is sitting down in the armchair right after dinner, which is the exact moment the walk would do the most good. For the safe version, this is the gentlest walk of your day. You can do it indoors, around the kitchen and living room, back and forth. There is no need to go outside in the dark or the cold after supper. Hold a counter or the back of a couch if you need a steadying point. If you feel lightheaded after eating, sit first, let it pass, then walk. And if you take medication for diabetes, talk to your doctor before making this a habit, because your blood sugar readings may change and your doses may need adjusting. Pair this after meal walk with the simple act of putting your fork down between bites during the meal itself. Slower eating means a gentler sugar rise to begin with, and the walk then finishes the job. The two together are far stronger than either one alone. Now, calmer pressure and steadier blood sugar protect the pipes themselves. But there is a deeper problem happening inside the walls of those pipes, a kind of slow rusting that walking directly reverses. That is number 3. Number 3, a 10-minute walk keeps the inner lining of your blood vessels smooth, flexible, and young. Let me explain this lining, because most people have never heard of it. Every artery in your body is lined on the inside with a single delicate layer of cells called the endothelium. This layer releases a substance that tells your arteries when to relax and open. As we age and as we sit, that lining gets stiff and sluggish, like a hinge that has started to rust and no longer swings freely. When blood rushes past it during a walk, the friction of that flow signals the lining to release its relaxing substance and stay supple. Movement is what oils the hinge, Stillness is what lets it seize. Large research reviews have consistently linked regular walking to better blood vessel function in older adults, measured directly in the arteries. This is not theory. It is visible in the vessels themselves. Here is your protocol. This benefit comes from the flow of blood during the walk. So what matters is getting your circulation up gently for the full 10 minutes. Walk at that same talking pace, where your breathing deepens, but you are not gasping. 10 minutes, once a day, is the maintenance dose that keeps the lining active. If you want a little more, you can add small changes in pace. 90 seconds a touch quicker, then back to easy. But this is optional and never required. The mistake here is thinking you must walk hard to get this. You do not. Steady, gentle flow, done daily, is what keeps the hinge oiled. For safety, because a change of pace can catch you off guard, only add those faster stretches on a flat, clear, familiar path. Keep your eyes up and ahead, not down at your feet, and never rush on a wet or uneven surface. If a quicker pace makes you breathless or unsteady, drop straight back to easy. Sharp pain or real breathlessness means stop, not push through. Your everyday steady walk already delivers most of this benefit, so there is no pressure at all. Pair this walk with a few slow, deep breaths through your nose as you go, in for 3 steps, out for 3 steps. Calm nasal breathing helps your arteries relax through the very same signal the walk is triggering. So your breath and your steps are working on that vessel lining together, one reinforcing the other. But a smooth, flexible pipe is still only a pipe. What decides whether your heart itself grows stronger or weaker over the years is something that happens to the heart muscle during that same short walk. That is number 2, and it is the one most people underestimate the most. Number 2, a 10-minute walk gently trains your heart muscle to become stronger and more efficient. Here is the mechanism. Your heart is a muscle, and like every muscle, it responds to gentle, regular demand by becoming better at its job. When you walk, your heart beats a little faster and fuller to meet the demand from your legs. Over time, it learns to pump more blood with each beat, so it can do the same work with fewer beats. Think of it like a rowing crew that finds its rhythm. Instead of many frantic, shallow strokes, they settle into fewer, long, powerful pulls that move the boat farther with less strain. A trained heart is a calm, efficient heart. Cardiac rehabilitation programs around the world are built on exactly this principle, using gentle daily walking as a foundation to strengthen aging and recovering hearts. This is established, everyday clinical practice. So here's the protocol. To train the heart muscle, you want your walk to reach that talking but not singing pace, and hold it for the full 10 minutes, so the heart gets a steady, sustained demand. Once daily is your foundation. As it gets easier over a few weeks, and it will, you extend the time before you add any speed, working from 10 minutes toward 15. The progression is always time first, effort second. The common error is pushing the pace hard for 2 minutes and calling it a workout. Your heart is trained by steady, sustained, gentle effort, not by short bursts of strain. For the safe setup, this is where listening to your body matters most. You should be able to speak a full sentence throughout. If you cannot, you are working too hard, so ease off. Never hold your breath or strain. Keep a rail, wall, or bench within reach on your route. And this is important. If you have a known heart condition, or you feel chest pressure, an unusual racing or fluttering, or breathlessness that seems out of proportion, stop and check with your doctor before continuing. Talk to your doctor before starting if you have any heart history at all. Pair this walk with a simple minute of sitting quietly afterward, one hand resting on your chest, just noticing your heartbeat settle. That gentle cool down helps your heart transition smoothly, and over time, you will feel it settling faster, which is your own proof that the training is working. So we have covered your pressure, your blood sugar, the lining of your vessels, and the strength of your heart. 4 powerful things from one short daily walk. But the number one item, the crown of this whole list, happens above your shoulders. It is the reason I made this video, and it is the thing that a 12-minute appointment never, ever has time to explain. Number 1, A 10-minute daily walk protects your brain, sharpens your memory, and helps guard the independence of your mind. Let me tell you exactly what happens up there, because this is the deepest mechanism in this whole video. Your brain is astonishingly hungry. It is a small organ, but it demands a large and constant share of the blood your heart sends out. It has almost no way to store its own fuel, so it depends entirely on a steady, rich flow of oxygen and glucose arriving minute after minute. When you walk, and that second pump in your legs pushes more blood upward, your brain receives a surge of fresh, oxygen-rich flow. Think of your brain like a garden at the far end of the whole river system we talked about. When the current runs strong and steady, every plant is watered and green. When the current slows to a trickle, the plants at the far edges are the first to wither. Your memory centers sit at that far edge. A daily walk is what keeps the water reaching them, but it goes deeper than flow alone. That same walking motion prompts your brain to release small amounts of a protein that acts like fertilizer for brain cells. This substance helps existing brain cells survive and helps new connections form, especially in the region most tied to memory. So walking does not merely feed the garden, it helps the garden grow new roots. Large and well-regarded studies of older adults have consistently found that those who walk regularly show slower memory decline and better preserved brain volume than those who stay still. The research here is deep, and it points steadily in one direction. Motion protects the mind. So here is your full protocol for the crown, and I want you to treat this one as the anchor of your whole day. Walk for 10 minutes, once every single day, without exception, at that talking pace where blood is genuinely moving. Consistency matters more here than for any other benefit on this list, because the brain protective effect comes from the daily repetition, the steady watering of that garden, not from any single heroic effort. Anchor it to something you already do every morning, right after breakfast, or right after you brush your teeth, so it never depends on motivation. To deepen the effect, walk somewhere with a little to look at, a street, a park, a changing view, because giving your eyes and mind something new to process while you move adds a mental workout on top of the physical one. If you can, walk with another person and hold a conversation, because moving, seeing, and talking all at once is one of the richest workouts your aging brain can get. The mistake people make is treating the walk as optional on busy or low days. Those are the days your brain needs it most. Now the safe setup, and for the crown, I want this to be truly secure. Choose a route you know well, so your mind is free to wander and enjoy rather than worry about where you are going. If you walk outdoors, go in daylight, wear supportive shoes, and stay on even, familiar ground. If balance is a concern at all, walk indoors in a hallway, or walk in a loop where a wall or rail is always within arm's reach. Never walk somewhere you feel unsafe or rushed, because stress works against the very calm blood flow we are trying to build. If you feel dizzy, confused, or notice sudden weakness on one side, or trouble speaking, stop at once and seek help, as those can be signs that need urgent attention. Sharp pain or real unsteadiness means stop, not push through. Pair this brain walk with a full night of sleep behind it whenever you can, because your brain does its deepest cleaning and memory filing during sleep, and the morning walk then delivers fresh flow to a brain that has just tidied itself. Think of sleep as the night shift that files everything away, and the walk as the morning delivery that brings in fresh supplies. Each one makes the other work better, so protect both as a pair. And here's the payoff I promised you at the very beginning, the thing almost nobody talks about. Everything else on this list, your pressure, your blood sugar, your vessels, your heart, all of it ultimately serves this one organ. A strong heart and clean vessels are not the final goal. They are the delivery system that keeps your brain fed so that you stay yourself. The reason a 10-minute walk can change how you approach the next 10 years is that it protects the one thing that makes those years yours: your mind, your memory, your ability to know the people you love and to make your own choices. That is what is walking with you every morning. Let me show you how this comes together in a real life, honestly framed. Consider a typical case documented in the rehabilitation literature. A 74-year-old woman who had slowly stopped going out. Her blood pressure ran high despite her medication. Her after-meal blood sugar was creeping upward year by year. And most troubling to her, she had begun losing words in conversation and forgetting why she walked into a room. She felt herself shrinking, and she was frightened of becoming a burden to her children. Her program was not dramatic, and that is the point. She began with a 5-minute walk after breakfast and a 5-minute walk after dinner, indoors, holding the back of a chair when she needed it. Within 2 weeks, she was walking 10 minutes at a stretch, still indoors, still unhurried. She anchored her morning walk to right after her tea and her evening walk to right after supper, so she never had to decide. She added slow nasal breathing as she went, in for a few steps and out for a few. And on good days, her daughter joined her, and they walked and talked together. The change over 3 months was measurable. Her resting blood pressure came down enough that her doctor reviewed and adjusted her medication. Her after-meal sugar readings settled into a steadier range. And the change she cared about most, she said the words came back to her more easily, and she felt present in her own conversations again. She had not added hours of exercise. She had added 20 minutes, split in 2, done daily. So here is your action matrix. Simple, specific, and starting today. Tonight, after your largest meal, stand up within 30 minutes and walk for 10 minutes, even if it is only back and forth across 2 rooms. That single walk is the one with the fastest payoff because it catches your blood sugar right as it rises. This week, anchor one walk to one thing you already do every single morning, whether that is your tea, your breakfast, or brushing your teeth, so the walk happens without a decision. Habits survive when they lean on habits you already have. Every day, hold that talking but not singing pace for the full 10 minutes, where you can speak one sentence but not sing a song. That one pace is how you know the dose is right. Starting now, keep one hand free near a wall or a rail every time you walk, and stop the moment you feel sharp pain, chest pressure, or real dizziness. And within the next month, once 10 minutes feels easy, extend toward 15 minutes before you ever add any speed, because time comes first and effort comes second. Think of someone in your life who has been slowing down, staying in more, losing a little of their spark. Send this video to them today, because 10 minutes a day is a small thing to ask and a large thing to protect. It is always easier to start when someone starts it with you. Tell me in the comments which of these 5 you are starting tonight. Your answers decide exactly what I cover next. And if you want more of the science your appointments never have time for, subscribe to this channel, because that is the whole reason it exists, to give seniors the why behind the advice, one clear video at a time. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Laura Bennett. Don't forget to subscribe and live longer.